Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Signs of impending death after stroke. Physical outcomes of a stroke can range from very minimal impairment to coma and death, with stroke being the fifth leading cause of death in the United States. Signs of impending death after a stroke may include difficulty breathing, pain, and a rattling sound in the lungs. /r/n/r/n A person who has had a serious stroke may require palliative care, a type of care that provides symptom relief for patients with a serious illness that interferes with their quality of life. Palliative care may be temporary or long-term while a patient is receiving treatment, or they can transition into hospice care if the prognosis becomes terminal. /r/n/r/n This article goes over the symptoms of stroke, when palliative care is appropriate, and how to identify the signs of impending death in someone who has had a stroke. /r/n/r/nrnLPETTETGetty Images /r/n/r/n A stroke, or cerebral vascular accident, CVA, is an abrupt interruption in the brain's blood supply. The interruption could be caused by an occlusion of the arteries that supply blood to the brain, ischemic stroke, or from bleeding within the brain, hemorrhagic stroke. /r/n/r/n The effects of a stroke on functional recovery and mortality are mediated by the patient's age, the location of the brain affected, the severity of damage to the brain tissue, and the presence of other comorbid conditions. /r/n/r/n After a stroke, a person's prognosis depends on many different factors. It may take a few weeks to know whether they can be expected to recover. /r/n/r/n Palliative care for an acute stroke or chronic cerebrovascular disease from a stroke focuses on symptom management. Because the neurological system is involved in the functioning of practically every other body's system, the distressing symptoms requiring treatment can be very diverse. /r/n/r/n Some of these symptoms include the following. /r/n/r/n Accessing palliative care as soon as it becomes appropriate will ensure that symptoms are managed properly and will help prepare you for what lies ahead. /r/n/r/n It is not always possible to tell whether someone who has had a severe stroke will die. Getting medical help as soon as possible can improve a person's chance of survival, but certain types of strokes are more likely to be fatal, especially those that affect the part of the brain responsible for automatic functions like breathing and circulation. /r/n/r/n In the most severe cases, a patient may be in a coma and exhibit abnormal neurological responses such as no response to painful stimulation, no verbal response, and no brainstem activity. Hospice is considered when there is a poor prognosis. /r/n/r/n Death from stroke may occur immediately or it may happen in the weeks or months afterwards. Signs of impending death after a stroke may include /r/n/r/n Because DH can occur at any time following a stroke, someone who has experienced a severe stroke should receive hospice care as early as is appropriate. For example, if there is no improvement in neurological functioning after the first 3 days following a stroke, this can be a sign that the person needs to be placed in hospice care. /r/n/r/n Life expectancy after stroke can vary considerably depending on the overall health of the person as well as the type of stroke they had, how quickly they were able to receive medical care, and whether they became disabled after their stroke. /r/n/r/n For example, the life expectancy after a stroke for an 80-year-old male who has no significant disabilities is around 9 years, while someone the same age and gender who has a severe disability after a stroke has a life expectancy of years. /r/n/r/n Factors associated with increased risk of death from a chronic stroke include /r/n/r/n A person who is in a coma after having a stroke will be evaluated using the Glasgow Coma Scale. This helps their healthcare provider monitor them for signs that they may be improving or worsening. /r/n/r/n A score between 3 and 15 is given based on how the person responds to a painful stimulus, whether they respond verbally or move in response to a command, and whether they open their eyes spontaneously or in response to a stimulus. /r/n/r/n locked-in syndrome is a very rare condition in which a person is conscious but unable to move or speak. It can occur after someone has a stroke in the brain stem. /r/n/r/n someone who has had a stroke may recover completely or may experience permanent disability. Others may die in the weeks or months after having a stroke. /r/n/r/n it is not always possible to tell whether someone will die after a stroke. If they show little signs of recovery after the first few days, it's a sign that they may need to be transferred to hospice care. Signs that someone who has had a stroke is close to death include difficulty breathing, pain, and a characteristic rattling sound in the lungs. /r/n/r/n, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.